Senator Osler.
Chers collègues, je prends la parole.
Dear colleagues, I rise today to speak about a subject about a zero net emissions future.
For her ongoing leadership on the climate crisis. In my preparations, I read the speech she made in this chamber in February of 2022 on the subject of Senator Galvez's motion to recognize that climate change is an urgent crisis. In her speech, Senator Coyle questioned if the motion could motivate senators to come together to better understand climate change and to seek solutions. Her answer was yes. And so, colleagues, today I will use a health lens and speak in favor of inquiry number 4. Why use a health lens, you may ask? In 2009, a joint commission between The Lancet, an internationally renowned medical journal, and the University College London called climate change the biggest global health threat of the 21st century. The Lancet continues to release an annual report called The Lancet Countdown on Health and Climate, and in their 2023 report, they called out the imperative for a health-centered response in a world facing irreversible harms. They noted that the health risks of climate change are increasing across all dimensions monitored, yet adaptation efforts have been insufficient to protect people from the growing hazards. They stressed the need for urgent efforts to ensure climate health hazards do not exceed the capacity of our healthcare systems to care for us. Colleagues, you have heard me speak about the multiple capacity challenges currently facing our healthcare system. So today, my remarks will focus on 3 points. First, the relationship between climate change and human health, with an emphasis on Canadian data. Second, the relationship between climate change and the healthcare sector in Canada. And finally, some of the enablers for our healthcare system to transition to net zero emissions. So let's begin with the relationship between climate change and human health. Globally, healthcare professionals are witnessing not only how climate change is affecting health, but also how climate change is impacting health systems. Climate change is already harming the health of Canadians due to the increased frequency of extreme weather events and natural disasters. Think back to the 2021 heat dome in British Columbia. It was the deadliest weather event in Canadian history, with an estimated 619 heat-related deaths. Healthcare professionals are also seeing more respiratory issues from air pollution. Globally, fossil fuel-related air pollution is associated with 6.7 million premature deaths annually. And Health Canada estimates that air pollution contributes to more than 15,000 deaths per year in Canada. In 2016, it was calculated that the total economic cost to Canada for all health impacts attributable to air pollution was $120 billion, or the equivalent of 6% of Canada's GDP. Colleagues, you will also recall that in 2023, Canada had its worst year on record for forest fires. Now, in April 2024, there are concerns for an even worse upcoming forest fire season. Dr. Courtney Howard is an emergency room physician and international expert on the impacts of climate change on human health. In 2021, Dr. Howard and her colleagues published an article that examined the health impacts of a severe and prolonged wildfire season in Canada's high subarctic. The article focused on the Northwest Territories, where in 2014, moderate to severe drought conditions led to a severe fire season, with 385 fires burning down 3.4 million hectares of forests. The wildfires caused 2.5 months of consistent smoke exposure for the residents of Yellowknife and adjacent Indigenous communities. In fact, some Northwest Territory residents refer to this season as the lost summer or the summer of smoke. To assess the burden of wildfire smoke on health resources The study compared 2014 to previous non-extreme fire years. They examined dispensations of salbutamol, and that's the blue puffer. And salbutamol is a medication used to relieve symptoms of coughing, wheezing, and shortness of breath, as well as clinic visits, emergency room visits, and hospital admissions for respiratory causes. The severe wildfires and extended poor air quality were found to be associated with increases in health resource utilization. The study found that in 2014, salbutamol dispensations increased by 48%. Clinic visits for asthma, pneumonia, and cough increased. Emergency room visits for asthma doubled. Emergency room visits for pneumonia increased by 57%. And hospitalizations for chronic obstructive pulmonary disease also increased. Some of the impacts were disproportionately seen among specific populations, such as children and Indigenous individuals. The Senate Standing Committee on Agriculture and Forestry will be studying wildfires in Canada and their impact on forestry and agricultural industries. I look forward to reading their report and recommendations because climate solutions to reduce wildfires will reduce air pollution and will not only increase health and well-being, but can also reduce health resource utilization for any climate change-related respiratory issues. For my second point, let's briefly touch on the healthcare sector's impact on climate change. The healthcare sector is estimated to be responsible for 4.6% of Canada's total greenhouse gas emissions. And in fact, globally, Canada has the second highest per capita greenhouse gas emissions from the healthcare sector. Now, we all recognize that Canada's healthcare facilities are critical community assets that need to remain open and provide care 24 hours a day, 7 days a week, 365 days a year, regardless of what crises the country may be facing. Yet many of our healthcare facilities are amongst Canada's oldest public infrastructures in use today, with almost 50% of facilities having been built over 50 years ago. Healthcare facilities are significant contributors to Canada's healthcare sector greenhouse gas emissions because of their age, physical needs, and lower energy efficiency. And when you combine aging infrastructure, deferred maintenance, and some facilities having been built in high-risk zones like floodplains, it's easier to understand how climate health hazards could exceed the capacity of the healthcare system to look after Canadians. For my third and last point, I want to highlight some of the enablers for the Canadian healthcare system to transition to a net zero future. In the Canadian Medical Association's policy on environmentally sustainable health systems in Canada, they outline the need to maximize our healthcare system's resilience to the increasing health needs and other impacts of the escalating climate crisis, and to minimize the negative impacts that our healthcare systems have on the environment and climate change. In 2021, at the UN Climate Change Conference in Glasgow, or COP26, Canada made a commitment to deliver a low-carbon, sustainable health system, but did not identify a net zero target. In contrast, Britain's National Health Service, or NHS, is a global health leader that has been tracking and reporting on its carbon footprint for the last 14 years. In 2020, the NHS declared its commitment to net zero with two clear and ambitious targets. First, to reach net zero by 2040 with an 80% reduction in emissions under direct NHS control. And second, to reach net zero by 2045 with an 80% reduction for the emissions that the NHS can influence. Their early projections estimate that by the year 2040, 5,770 lives will be saved per year in the United Kingdom due to reductions in air pollution. That said, the Canadian healthcare system does acknowledge its responsibility to reduce its carbon footprint and to minimize the widespread harms to human health. Healthcare Can is the national voice of healthcare organizations and hospitals across Canada. They support its members' net zero initiatives to green their operations, ranging from easy-to-implement projects to more extensive and expensive building retrofits. One example of an easy-to-implement enabler is to change the anesthetic gases used during operative procedures. Certain anesthetic gases, like desflurane, have high carbon footprints, with desflurane estimated to be 2,450 times more potent as a greenhouse gas emission compared to carbon dioxide. Eliminating the use of desflurane is one of a hospital's most impactful interventions to lower carbon emissions. And so dozens of hospitals across Canada have removed desflurane from their operating rooms and have switched to less carbon-intensive anesthetic gases. Healthcare facilities also produce significant amounts of waste, with the worst offenders being single-use disposable items. Thankfully, there are initiatives in Canada to reduce healthcare facilities' reliance on disposables and to divert waste from landfills. Finally, another enabler is to invest in health infrastructure and to retrofit healthcare facilities. You've just heard how many of Canada's healthcare facilities are amongst our oldest and energy-intensive public infrastructures in use today. Investments in health facility infrastructure can reduce their vulnerability to the impacts of extreme climate events and reduce the healthcare sector's greenhouse gas emissions through the building of higher energy efficient facilities that use more sustainable and cleaner energy sources. In closing, I was pleased to see the leadership of Canadian healthcare professionals, associations, and organizations lighting the way towards net zero, environmentally sustainable, and climate-resilient healthcare systems. The path forward for a net zero health system in Canada is possible. I'm also honoured to add my voice to those of Senators Coyle, Galvez, Youssef, Klein, Quinn, Black, Omidvar, Kuchar, and Lafreda. Colleagues, thank you, merci, miigwech for your attention.